So this video is dural venous sinuses. First of all, there are venous sinuses which are present in the cranial dura, and they are formed in the following two ways: by the separation of the two layers of the cranial dura and by the reduplication of the meningeal layer. All the venous sinuses except the inferior sagittal and straight sinus lie between the meningeal and the endosteal layers of the dura mater. The sinuses, which have thin walls and are lined by the endothelium, which is continuous with that of veins, they drain blood from the brain and skull bones. Then, the blood from the dural venous sinuses is ultimately drained into the internal jugular vein. Internal jugular vein is here. The blood from the dural venous sinuses is ultimately drained into this vein. So, the dural venous sinuses characteristic features are they lie between the layers of the dura mater. They have no muscle in their walls. They are lined by the endothelium, which is only muscular coat is absent. Then it is devoid of valves in their lumen. They receive venous blood and CSF. So these dural venous sinuses receive venous blood and CSF. Then we have the emissary veins, which regulate the blood flow and maintain the equilibrium of the venous pressure within and outside the skull. Now we go on to the classification of the venous sinuses. First of all, uh, the classification, there are seven paired and seven unpaired structures. For in the seven unpaired ones, we have the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intracavernous sinus, posterior intracavernous sinus, and basilar venous plexus. And in the paired sinuses, we have cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, and petrosquamous sinus. The middle meningeal veins are often termed as middle meningeal sinuses. The sigmoid and the transverse sinus together are called the lateral sinus by the clinicians. Now, this is the diagram which is very simple actually. First, we need to draw the superior sagittal sinus, then, we need to draw the inferior sagittal sinus, then, we need to draw the transverse sinus, then, we need to draw the superior and inferior petrosal sinuses. This is the cavernous sinus which is paired, so there will be two of them. And then we move towards the main thing. If an LAQ comes as a 10 marks question, first we need to describe the dural folds, the dural venous sinuses, then we move on to the cavernous sinus detail. So cavernous sinus has an optic chiasma. It has its extent, first we will learn. It extends anteriorly up to the medial end of the superior orbital fissure and posteriorly up to the apex of the petrous temporal bone. This is the diagram that need to be drawn for the cavernous sinuses, in which we have the sphenoidal air sinus, endosteal layer, then we have the meningeal layer, then we have the oculomotor, trochlear, ophthalmic, maxillary uh, nerves. These are the nerves. Then we have the mandibular nerve, then we have the abducens nerve, then we have this internal carotid artery, then we have the this is the hypophysis cerebri, which is also known as pituitary gland. First of all, then anterior extent, we know that is the medial end of the superior orbital fissure. Posterior extent is from the apex of the petrous temporal bone. Then we move towards the relations, which is superior, inferior, medial, anterior, and posterior. First of all, we will move towards the superior. Let's see here. Superior relations are optic chiasma, which is present here. This is the superior relations. Let's mark the superior relations of it. So optic chiasma is in the superior, and internal carotid artery is also from the superior part. Then we have the inferior, we have the foramen lacerum. Then we have the medial, which is the pituitary gland and sphenoidal air sinus. Sphenoidal air sinus is present over here. Then we have from the lateral part, we have the temporal lobe of the cerebral hemisphere. And anterior part, we have the superior orbital fissure and the apex of the orbit. And the posterior part, we have the crus cerebri of midbrain and apex of the petrous temporal bone. Then structures, these are the structures passing. Then we need to learn the structures passing through the cavernous sinus. Let's draw them. First of all, there are structures passing through the cavernous sinuses are internal carotid artery, which is surrounded by a sympathetic plexus of nerve. Then we have the abducent nerve. These are the structures passing through the cavernous sinus. Then abducent nerve, which is passing the pterosphenoid ligament and accompanies the inferolateral aspect. First of all, we need to learn only these two arteries, which are the internal carotid artery and the abducent nerve. Then we need to learn the tributaries of the cavernous sinus. This is an question. First of all, we need to draw a foramen magnum, which contains the basilar plexus, which is joined over here. Then we have this. Then we need to name the structures which are coming from the uh, orbit, meninges, and from the brain. This we need to draw. Then we need to. I'm showing you how to draw this draw this diagram in exam. Okay. Then we need to draw these connections. Then we need to draw a straight sinus and a superior sagittal sinus. So this one will be straight sinus. This one will be a superior sagittal sinus.